track can specialize if they haven't already specialized, and then some of them go to do their master's, some to do their PhD. The first 3 lines indicate the existing track where there's a basic diploma followed by a post-basic diploma and a top-up. There's a specialty bachelor and or vice versa. But the ideal track is high school to attain a bachelor degree. Again, similarly with the allied health education, currently what exists is a diploma of health sciences. Some would top up, some do not have a top up. Those who don't have a top up must be topped up. The ideal track is high school, Bachelor of Sciences, and then they follow a similar track for faculty and for clinicians. Similarly for pharmacy. Also for public health, except with public health, the individual can just enter from, those who have a bachelor in any health-related discipline can directly go to the faculty track or the clinical track. This is a summary where it's proposed, and the vision is for of course, medical doctors to do their fellowship and specialize, for pharmacy, for nursing, health sciences, public health, and dietetics, is to go through a bachelor program and then go either faculty track or clinical track. This is a very, very quick overview, and it's trying to summarize over 300 pages of material. And I hope it provides just an overview of what the health professions education document is about. Thank you very much.
Thank you very much. Any questions, or shall we move on? We will have thank you very much, Mr. Abdullah Battashi. And we'll have the last session before the break, and we're going to switch to another field of medicine and hopefully cooperation. We were hopeful that representatives of the Royan Institute could make it to Oman. However, because of the short notice, they could not make it. We have an agreement to host them at a later time so that we continue the negotiations and the efforts for collaboration. I'm pleased to introduce Dr. Maha Al-Khadouri. She's a senior consultant in obstetrics and gynecology. She is a graduate of McGill University training. Of course, she did her medical school in Sultan Qابوس University. She is my batch, so we are both young. And her main interest is infertility. She's trained in female infertility. Without further ado, I think Dr. Maha is going to start once the connection happens. There you go.
Right, Assalamu alaikum. I'm very happy to be here today to be part of this interesting symposium. I'd like to thank the organizers for inviting me to speak today and represent something about, we've gone to about Oman. Okay, so actually the title of my talk is slightly different to what's in your schedule. So I'm going to talk about reproductive endocrinology and fertility in Oman and SQUH. Dr. Hani has introduced me as a senior consultant in the Department of Obstetrics and Gynecology. I'm also a reproductive endocrinologist and fertility specialist. And in fact, I've done training in assisted reproductive technology in Canada. So my expertise is not restricted to infertility only, per se. It's far wider than that. So the outline of my presentation today is going to be about Oman. I'll talk mainly about Oman on infertility statistics and services, whatever we have. We'll talk about Sultan Qابوس University Hospital, the services that we're providing in the gynecology department, as well as some of our statistics. I'll talk a bit about assisted reproductive technology, the needs for Oman, as well as what should be the future of assisted reproductive technology in Oman. Just a brief introduction about infertility. It affects about 12 to 15% of all couples in reproductive age, so Oman not excluded. And usually the causes are 50% due to female problems and 50% due to problems in the male. If we look at assisted reproductive technology in the world, and a lot of the evidence and literature statistics come from North America and Europe, we find that now ART accounts for 1 to 3% of live births, and more than 4 million pregnancies have been created to date from assisted reproductive technology. Looking at fertility in Oman, this is a paper which was published in Sultan Qابوس University Medical Journal by Professor Samir Adawi from SQU and Dr. Asir Riyami from Ministry of Health. And this was in 2006, and they were looking at the effect of education among women and the fertility, and basically what they found was that fertility was on the decline in Oman. This table is from that paper, and it basically shows you the comparison of fertility among women in reproductive age between 1994 and 1995 and 1999 and 2000. And you can see that for all age groups, in fact, the fertility is reduced in Omani women. Looking on the net and looking at what are the official fertility rates, we find that fertility currently for 2013 is 2.86 children born per woman. It used to be 4.2 in 2001, so yet again there is a confirmation that fertility among Omani women is reducing. Whereas if we compare it to the fertility rate in Iran currently, it is 1.64, which is lower than what is for the Omani population. Now, do we have accurate estimates of infertility in Oman? Probably not. There are multifactorial reasons for this. Most likely because it's still seen as a social stigma, so patients don't all present to government institutions for care. They may go to private institutions, and several of them, or many of them, may be traveling to other countries to seek treatment in order not to be exposed within their own society and community. There is some work from 1999 where they found that in the Ministry of Health that most of the infertility cases who were attending the clinics at the Royal Hospital, which is a tertiary care hospital, and the andrology clinic at Nahda Hospital, which is a secondary care hospital. What they found was 50% of infertile couples were treatable, and 35 to 50% were due to female factors alone. Now, when we look at the data from the annual statistical report in the year 2000, looking at outpatient attendance, they found that male infertility was at the rate of 7 per 10,000 of population, and in females it was 185 per 10,000. So we can see that the female causes are a lot higher than male. Looking at the statistics, which I could find, the most recent ones from primary health care from the Ministry of Health, they've seen in 2012 1,509 women with infertility. 846 of them had primary infertility, and 663 had secondary infertility. And in terms of males, it was 1,505, so almost equal numbers. We've done several studies on reproductive endocrinology issues among Omani women. I'm just quoting here one of the studies that we've done on looking at tubal factor infertility in women. This was published in 2013, Journal of Reproduction and Fertility. And basically we looked at women who had had hysterosalpingogram here at Sultan Qابوس University Hospital, and the cohort was 218 women. Out of them, 115 who had primary fertility and 103 who had secondary infertility. And we found that there was a higher level of polycystic ovary syndrome in the women with secondary infertility, as well as history of ectopic pregnancy, also pelvic inflammatory disease, and previous pelvic surgeries, which would predispose to tubal obstruction. And the second table at the bottom shows you the tubal obstruction, whether it was unilateral or bilateral in both the primary infertility cases and the secondary infertility cases. And we found that there was a statistically significant difference among women who had unilateral blockage of tube among the secondary infertility group. Now, moving on to what has the Ministry of Health produced in terms of infertility for Oman? This is the infertility standard operating procedure from 2001. This was a combined effort between the Department of Family and Community Health and the Department of Obstetrics and Gynecology at Royal Hospital, as well as the Department of Dermatology at Nahla Hospital. And this is basically what is being practiced within the Ministry of Health system, even to date. So for primary health care, patients present there and they have a clinical evaluation, preliminary investigations, then they're referred to higher healthcare facility for further evaluation and management. For secondary care, they will review the case records again and the investigations and may develop a further plan of management. And the patient, when referred to tertiary hospitals, they will reevaluate the entire case, investigations. They may do special testing because not all the investigations are available in the primary and secondary care. There's restrictions on what's available at that level. The patients, if require assisted reproductive technology, will be counseled, information will be given to them. If they require intrauterine insemination, that's available in Oman, currently at 3 sites, SQUH, Royal Hospital, and Khawla Hospital. And if they require IVF, ICSI or pre-implantation genetic diagnosis, then that has to be provided outside of the Ministry of Health facilities, as it does not exist currently in Ministry of Health nor in Sultan Qابوس University Hospital, and usually at the patient's own expenses. However, there is a treatment abroad committee which looks at individual cases, and we have sent them patients whom they have sponsored for IVF, whether locally in private centers or sent them abroad for treatment, if that treatment is not available in the private sector in Oman. Coming to the private sector, so currently I believe it's 5 centers which are providing assisted reproductive technology in Oman. There's no pre-implantation genetic diagnosis being performed here in Oman. And with regards to cryopreservation, obviously sperm's been cryopreserved for many years because it's easier technology. However, when it comes to oocyte freezing, there's only 1 center that's performed oocyte freezing to date, and a couple of the centers are performing embryo freezing. Also, Ministry of Health decided that there need to be some standards and regulations given the increased number of assisted reproductive technology centers. I was asked by the minister to chair a task force to come up with these regulations. It was a well-represented committee with people from different sectors, religion, legal, OBGYN, embryology, public health. And so these regulations and guidelines are for all centers in Oman, whether they are in the public sector or in the government sector. And this is just to show you the contents of this document. So we went into scope and definitions, and then the rules and regulations. We proposed a Fertility Center Oversight and Control Committee, which will look at the practice in all the centers in Oman, the licensing of the centers, the staffing, prescribing medications, the ethics, health information and consent, storing unfertilized ova, sperm, and embryos, laboratory management, medical records and inspection standards and monitoring, cancellation of license and suspension of license procedures. Right, so that was Oman. Let's come to SQUH. Currently in the gynecology department, we do provide infertility treatments and clinics. There are 10 female infertility clinics per month and 1 combined infertility clinic, which is male and female infertility per month. With regards to the staffing, this is for the female infertility clinics that we run. There are 3 senior clinicians, 2 with an academic post, 1 professor, 1 associate professor, and a senior consultant, which is me. And we have a specialist infertility nurse. With regards to the combined clinic, and I'm not going in depth on male infertility, but we have 2 clinicians running that, 1 a consultant and 1 a senior consultant. This is our procedure room. I wanted to show you something from what we have in SQUH. This is where we perform our procedures. This is where we do our intrauterine insemination processing of the sperm. And this is where we do outpatient hysteroscopy, which is a very important procedure for gynecology, but more and more have been advocated for infertility patients. We ran the first series of outpatient hysteroscopy in Oman in 2010, April 2010. Okay, what are the statistics and numbers of patients that we are seeing at the Sultan Qابوس University Hospital? Here in this graph, if you look at the blue line, that's the gynecology clinic, female infertility patients. 2013, we had 1,605 women. In red, we have the combined clinic, so mainly the male infertility, and we had 132 in 2013. Looking at now 2014, we're just at the, not even middle of the year, and for women we have 600 patients. And the numbers have been growing over the years, and the demand is there. What are the procedures we perform in the gynecology department to provide service for fertility for women? We perform hysterosalpingogram, which is contrast imaging to look at tubal patency. We do about 16 per month. We do ultrasound follicular tracking, hundreds of patients that are undergoing that. We perform ovulation induction and superovulation with medication, and some of the latest medications such as aromatase inhibitors we've been using, and gonadotropins. We perform intrauterine insemination, and 2013 to 2014, we had 84 cases of IUI. Outpatient hysteroscopy, we started that. It's hopefully going to be a more continuous process of outpatient hysteroscopy. And operative laparoscopy and hysteroscopy, because we have the expertise and we have the setup and the equipment for it. Now, with regards to assisted reproductive technology, what do we mean by that? It's any method which is used to achieve a pregnancy by artificial means or partially artificial means, and used primarily for infertility treatment, and so also known as fertility treatment. Now, what are the assisted reproductive technologies that are available? So ovulation induction, superovulation, which we currently practice, intrauterine insemination, which is also available in Oman. However, our needs in the public sector are to have in vitro fertilization and intracytoplasmic sperm injection, as well as pre-implantation genetic diagnosis and cryopreservation of gametes and embryos. This is a video actually showing intracytoplasmic sperm injection. But what are the indications for IVF and ICSI? So it is usually recommended for male and female infertility. Obviously, there are specific criteria when it comes to the males and females. For pre-implantation genetic diagnosis, as well as for fertility preservation, we want to cryopreserve gametes. For the preservation of gametes, the technology now, the new technology is vitrification, whereas previously it used to be just cryopreservation. This is also something which is very much needed in Oman. Indications, cancer patients, and we have many young Omani women who have cancer. We're picking them up earlier, they're living longer, and some of them are having children. However, unfortunately, not all of them have the opportunity to have children. None of them have actually probably gone abroad and had any embryo freezing or oocyte cryopreservation. And there are some publications by Dr. Adel Ajmi from Sultan Qابوس University Hospital and Professor Mansour al-Mundhiri and their team on breast cancer in young women in Oman. So yes, we have young cancer patients who are candidates for this. We also have patients who require bone marrow transplantation to the extent that we've set up a bone marrow transplant unit, which you might see is being constructed and is almost the size of the hospital. As well, for women who have family history of premature menopause, it's better to conserve whatever gametes they have at an earlier age instead of having none when they try to have children. We've done some studies looking at the acceptance and the awareness and attitude towards oocyte cryopreservation in healthy young Omani women versus women diagnosed with cancer. This is a study which was just complete, what we found, this was a cross-sectional study. We found a high level of awareness among oncology patients. It was more than that of just gynecology patients. There was a statistically significant difference among the awareness. From both groups, there was a high perception of using, or acceptance of using oocyte cryopreservation for medical reasons, okay? And this was more acceptable to oncology patients. With regards to social oocyte freezing, we asked them, we had a group of medical students from SQUH who we conducted a survey on, and it still was not very acceptable to young Omani women. So for the time being, for medical indications, maybe in the future for social reasons. Pre-implantation genetic diagnosis, what do we mean by that? It's basically taking the embryos, making a genetic diagnosis by biopsying the embryos, and using different types of technology to make that diagnosis. FISH can be used, SMP array, and comparative genomic hybridization, and PCR methods. This is a video of two techniques of pre-implantation genetic diagnosis. This is the biopsy of the embryo. In the top video, we see assisted hatching using laser and then a biopsy of a blastomere from an embryo. And in the bottom video, we see polar body biopsy from an embryo. These are all lab technologies. So this is what is lacking in Oman, actually, and this is what we should have here in SQUH. And it's the embryology part of it. Of course, the genetic testing is done by a genetics lab. So we do have a genetics lab. However, we need to develop the expertise in our labs to provide genetics clinical services for couples in Oman as well. Who are patients who can benefit from this technology? Couples who have family history of inherited diseases. We have quite a lot in Oman, given the rate of consanguinity in our society. For gender selection, to prevent gender-linked diseases, couples who have children with an incurable disease, and this is actually more common than people may think in Oman, especially when we look at the inherited hemoglobinopathies. And if they need to have a compatible sibling, HLA matched, to be able to cure the child who's affected by using the stem cells from the cord blood for bone marrow transplantation.
2 minutes, ma'am.
Yeah, the needs for the future. So for clinical service, we need to have fertility preservation because of this bone marrow transplant unit that we have in young oncology patients. We have a need for HLA-matched embryos because of their hemoglobinopathies. We have a lot of inherited genetic and metabolic disorders, and we have a genetics unit, which is a very, very busy unit, and we get a lot of patients sent to us to counsel and investigate prior to sending them for IVF PGD. And for academic reasons, we should be able to provide postgraduate students with education and training, master's degree, PhD students who are of the background of science. So scientists and technologists, residents in obstetrics and gynecology, because it's mandatory training for them to have this expertise in ART, and fellows in reproductive endocrinology and fertility. And of course, the research. The research not just for its value of academia, but the research because for Oman, we find a lot of unique things, and to be able to cater for what our country requires. For the future of ART in Oman, and this is really my last slide, what do we need? So this is what we need. We need to have the Fertility Center Oversight and Control Committee activated and working. We need to have a national government-funded assisted reproductive technology unit in Oman. Preferably, it should be in Sultan Qابوس University Hospital because of the added value for research and training and teaching. We need pre-implantation genetic diagnosis. We have a huge cohort of candidates who require this, and currently we send them abroad for it. And we need a national assisted reproductive technology registry to be able to document every single cycle. This will definitely be very important when it comes to doing research to look at national strategies and priorities for healthcare in this specialty. And with that, I'd like to end my presentation, and thank you again very much for having me here.
Thank you very much, Maha. Any questions for Dr. Maha? Professor Nasreen.
We actually we have some information. There was a study conducted by Professor Salam al-Kindi here from Sultan Qابوس University Hospital, looking at how many babies were affected with inherited hemoglobinopathies. And more recently, we had a symposium in this very same place where he stood on this very same podium and said that almost 60% of Omanis were carrying a hemoglobinopathy gene. However, only maybe 10 to 20% of them have a serious hemoglobinopathy disorder, like thalassemia. So those are the numbers. Not very, 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 very accurate numbers, but these are the best estimates that they have so far.
Yes, please.
Yeah, so the Department of Hematology actually has so the question was, do we have any probes to identify the genetic mutations for the hemoglobinopathies? The answer is yes. The Department of Hematology does have the facilities and is currently diagnosing the genetic mutation for patients who have thalassemia and sickle cell disease. And there are many publications. If you go on PubMed, I think maybe you'll find some. And we have one named after Oman, so yeah.
Okay. Dr. Nabil?
Thank you, Dr. Maha. Do we have in our country official statistics about the rate of consanguineous marriage?
Yes, there are studies on that. I didn't go into that. There are studies on consanguinity in Oman. There are a few studies. I know the people who have been doing this research. I know Dr. Saeed Yahya has something, quite an old, I think, publication on that. More recently, there was a symposium on consanguinity, and there are people who have done some studies from our department on recurrent miscarriages and consanguinity. Dr. Wath Al-Ghafi, Dr. I think Gowri, and Dr. Yahya Al-Farsi. And I'm not sure if they've published it yet, but probably will be published soon.
Okay, yes, Dr. Sanfrush.
Thank you very much. I enjoyed the lecture. My question is, did you look into endometriosis? How much is
one of
the
the
cause of
studies,
infertility?
Yeah, one of the studies actually that we did, but it's not published yet. And we've started the study, and we have some preliminary data about the sort of numbers and the areas of Oman that these patients are coming from. So this is a study that we're conducting with Dr. Allal from the genetics department, and it's a study in process. So that's why I haven't quoted any results. I do have some preliminary data, but for the sake of time, I couldn't. But yes, we've looked at endometriosis as well. And then looking, hopefully, in the future for the genetic base of endometriosis in Oman.
Thank you.
Okay, thank you very much, Maha. I appreciate it. So now we're going to break.